iPax is an online system for physical and auscultation education. Up until now, we have invented hard-end software called Kikuzo and Ausculate, but the new iPax system is a multifunctional education system which does not only provide auscultation education, but provides ECG, UCG, and palpation education with a log management function. If you take a look at the image of a PC and a smartphone in the middle, for the university license, we have included the pulse feature. Also, students' usage is recorded on the log management screen, original contents by the university can be uploaded, and test problems can be created within the university license system as well. On the other hand, the student license enables students to use the system on their smartphones, and we recommend them to use earphones when listening to the sounds. In addition to being able to see the contents shared from their university, the AI feature will pick up cases necessary for the student to learn according to their characteristics. For example, if the AI judges from the student's studying record or the scores of quizzes and exams that the student has studied auscultation and has become good at it, but is not able to identify the relation with the ECG or UCG, it will recommend contents related to that. When you go to the My Page section, you will see the Recommend feature and the recommended contents will be shown there. On the lower hand of the screen, though only half the image is showing, is an image showing that the sphygmomanometer can be checked while listening to the Karakoff sounds, and palpation can also be done. Regarding auscultation, in the case of the heart sound, we have set the sound on 4 coordinates, which is the basic pattern. I would like to go over the actual screen with you. The AS case is shown here. Tap or click on the site to move the stethoscope icon for auscultation. If you move slightly away from the strongest sound point, the sound will decrease. The system is designed to make the sound loudest at the strongest sound point. In the case of AS, you can listen to the AS murmur on the neck area. If you turn on the lung sound function, you will hear both the breathing sounds and heart sounds at the same time. Vascular breath sounds can be heard here. At the pulmonary valve and tricuspid valve area, it is heard along with bronchial breath sounds. The other slide here shows a picture of auscultation being done while taking the pulse. This is done by connecting 2 Kikuzos with a distribution cable to a computer, and the pulse is output from one of them. When you press the pulse button on the screen, the pulse function will be turned on, and the pulse and heart sounds are set. The lung sound is on, but I'll turn it off this time. You should hear our beat per second sound from the left side and an AS heart murmur from the other side. This is the function to output the sounds to Kikuzo and listen to the sound with the stethoscope while palpating the pulse with the other. For lung sounds, I'd like to show you a fine crackle case. And for lung sounds, I've set the coordinates of the trachea and bronchi and the respiratory sounds of the alveoli by setting the coordinates to the area shown in this slide. Intense tracheal breathing, bronchial breathing, and then vesicular breathing sounds. Fine crackle sounds heard at the base of the lung. You can switch between anterior and posterior with the button. This is how it is set up. If you turn on the heartbeat, you can hear the heartbeat and lung sounds at the same time. As you may have noticed, the 4 coordinates of heart sounds are synchronized with each other. We have prevented any deviation, so I believe the sounds are realistic. I think we have all the auscultation cases we need for medical education as well. If you need a different case or want to use it for an examination, we can set it up for you. You can also do pulse palpation. Before that, I would like to show you that the interior chest image can be enlarged, as shown here. There is also an offline function, so if you press the offline button, it will be displayed in another tab. The title of the case will not be displayed, so you have to listen to the sound to figure out what the case is. If you zoom in on the body, the full screen display will lose the pulse button and the heart sound button. Click the refresh button and listen to the sound from 0 second. The system can be used offline, so if your internet connection is unstable during an exam, you may want to use this feature. The Korotkov sounds with pulse palpation are set up in the library, and I will introduce just one of them. And I will use 2 kikuzos to listen and do pulse palpation. You can feel the pulse from one side as long as you can listen to the Korotkov sounds. This is how you use it. In the case of a pattern that does not require the palpation method, only the Korotkov sound is output. But in the case of a pattern that requires the palpation method, we have created a system that allows the user to learn together with the pulse palpation. This is the other setting. X-rays, ECGs, still images, and videos I mentioned earlier can be posted from the management screen. If teachers post their information and data from the management screen, it will be available only to their own university's student group. This feature can be used for adding contents or exam questions. Things like conversation with patients, which Dr. Takashina talked about, are also in the form of dialogue, with text information in the lower part. You can learn by reading the text or by watching the video. You can listen to the auscultation sound by yourself while listening to the video explanation. If the video size is too large, you may not be able to post it, but you can post as many still images as you need. Maximum size that can be uploaded is 60 megabytes. You can also set up tests and quizzes. We have improved the quiz function of listening to sounds in the auscultation portal site we previously invented for Japan, and you can now listen to the sound using the interior chest or posterior image and answer the quiz. After answering the quiz, there is a function that allows you to review the results. And in addition to that, once you take the exam, you cannot take the exam the second time. So we have applied a feature that allows the students to take it one time only. We believe that this kind of system can be used for education of students and medical trainees. We have created a system that can also be used for exams and lectures. If you are interested, please contact Telemedica.